Hello, I'm Stephen Hamlin with mybodycanlearn.com. Welcome to my video series on posture and movement. We're going to cover the basic postural anatomy. If you have chronic pain, it's the last thing you want to do is study some stupid anatomy book. And how is that going to help my pain, you may say? Well, I can tell you, if you don't know these basic anatomy points, you really can't have good movement or good posture. And you will be creating pain just because you don't know where the joints are located. So where are the hip joints? You can see the hip joint is here and here. So in the body, it's halfway from the outside of the leg to the middle on the crease. So you bend from the hips. So this is where we bend. When we bend to sit down, like I'm showing you, this is where we bend. The hips are designed to bend. We're not designed to bend at the middle, at the back. Most people bend at the back all day long because their pelvis is stuck in a chair. In a chair, learn to move from the hips, like this. The next major point we need to know is the top of the spine. So this little spine has a little tiny vestige of the skull. So where is this junction of the skull and top of spine? If I ask the average client, they won't know. They're going to tell me the top of the spine is here. The top of the spine is not here. The top of the spine is between the ears. So this takes a little bit of thinking. When I first learned this, I said, what? So if I nod my head, you can see that the axis is between my fingers. This is it's like a stick with a tennis ball, rocking like this. This is how we nod the head. We nod the head like this. If you don't understand where that comes from, and you nod the head from here, your whole life you're going to be gesticulating wildly with your neck, tightening the neck, doing this unnatural movement like this to nod your head. It's a very easy movement. Once you know where the axis is, the front of the head's a little heavier, let it drop and bring it up with a little tension in the back of the neck. So nodding the head becomes very elegant and easy. When you're clear, where is the top of the spine? Top of the spine is the level of the nose, the level of the cheekbones, level of the ears. It's not down here. That's just basic anatomy. You need to know that one. Now, another piece of anatomy that is crucial for everybody to know is about the foot. Now, here's a little skeleton of the foot. So you can see the toes, you can see the leg bones here. This is the ankle bones, they're called. And this is the heel. Now, what is the ankle? I would like to suggest the ankle is not this whole thing. People think the ankle is this whole bottom part of the leg and top of the foot. The ankle is one bone called the talis. It's above the heel, below the leg bones, called the talis. This is the ankle. And this is where the Roman soldiers were taught to run, walk, and fight from the talis. And if you cannot put your mind on your foot and sense your own talis, I don't see how you can possibly have good standing posture. I don't see how you could be a good runner. I don't see how you could have good balance. There's a joint called the subtalis joint between the talus and the heel, subtalar. There's more nerve endings here than there are nerve endings the whole bottom of the foot. So we don't want to tense the feet because it interferes with the talus. So standing and walking and running is a soft foot. Balance happens automatically from the talus, built into the brain, built into the spine. Balance becomes easy, spontaneous, like a little child playing and dancing. If you think balance is the foot and tensing the foot, you immobilize all this. So this is basic anatomy that you need to know. The talus, look it up. Put your hand on your own, below your ankle bones and feel the talus. It's between the leg, the ankle bones and the foot. That's the talus. The next thing about basic anatomy is the curves of the spine. You'll hear people refer to this. We have 4 curves of the spine. So One of them is, we're born with it, the tailbone's tucked under a little bit like this. Then you have a lumbar curve here, the low back. Now the deepest part of the lumbar curve is right next to the sacrum, right here. Then you have a sweeping thoracic curve, a big, long thoracic curve like this. And then a neck curve like this. These curves are in opposition. We have 4 curves. When you have the 4 curves, it gives you springiness, it gives you strength, it gives you suppleness. If you think that sitting is a matter of stiffening and straightening the spine, you have no curves. You sit like a broomstick, sitting up straight. This is horrible posture. This is horrible self-abuse, what I'm doing to myself right now by stiffening the back, stiffening my spinal curves. You need to relax enough. You have these curves. Now, what people do, now this is the most important thing I can tell you, and I believe it's the most important thing, is when you're sitting, what everybody does to sit up straight, they stiffen like this, and they push forward here. Do you see that? They're slumped back, so they stiffen like this. And the low ribs are right here, they go forward. So, you can try this on yourself. Put your hands down your rib cage to the low ribs. Do the low ribs flare out? If that's the case, that means you've been doing too much. Sitting up straight, stiffening, pushing yourself forward from here. Try it. Push yourself forward from here. Try it just so you know what never to do. Try not to do this. This is like crunching the low back. When you do that, you're compressing the discs in the low back. You can see. It makes the curve too big. So when I'm standing, I like to have my hands like this because it pushes the low ribs down. Then I stand up straight. You can try that. Now people will tell you, this is body language for I'm shut down, I don't want to hear you. So this may have some body language like that, but this is very good for the posture. Keeping the low ribs down while you lift the chest. That's what we want to learn. This is going to take away a lot of back pain for many people. This little trick I'm showing you here. The material presented here is for information only. It summarizes the main tools that I have personally used for about 25 years as a Feldenkrais teacher. I've worked with many clients with serious medical issues and other people, and I've found these ideas are safe and simple, they're effective, but common sense dictates that you need your doctor's permission. If you have any questions, if there's any pain, you shouldn't do a movement. You should always be gentle, go slowly. If you have any doubt about the safety of a movement, respect that and don't do it. You can see a professional teacher of movement, an Alexander or Feldenkrais teacher. These people are very good. They've studied posture for a lifetime. You can trust them, and they can look at you, and in a glance, they can tell you what is going on in your body and what you need to do particularly to help yourself. And this can save you many years of futile effort and struggling doing everything or trying to accomplish something you don't really need to accomplish in the way of posture. When you have a professional, experienced person looking at you and you follow their advice, it can save you lots of effort and time.